Hey there, health enthusiasts! In today's video, we're diving deep into the incredible benefits of vitamin K2. We'll explore how this essential nutrient supports strong bones, promotes cardiovascular health, and may even offer benefits for brain function, insulin sensitivity, and male reproductive health. Stay tuned until the end to learn how you can incorporate vitamin K2 into your diet and supplement regimen for optimal health. Let's get started. Vitamin K2, also known as menaquinone, is a fat-soluble vitamin that plays a crucial role in various physiological processes, particularly in calcium metabolism, bone health, and cardiovascular health. While vitamin K1 is the primary dietary form of vitamin K, recent research has highlighted the unique benefits of vitamin K2. Vitamin K2 has several subtypes, differentiated by the length of their side chains ranging from MK4 to MK13. The most common and well-studied subtypes are MK4 and MK7. Dietary sources of vitamin K2 include animal products like meat, eggs and dairy for MK4, and fermented foods like natto, a traditional Japanese dish made from soybeans, for MK7. Cheese and eggs also contain vitamin K2. Interestingly, bacteria in the human gut also produce small quantities of vitamin K2, as shown in a 2019 study by Holder and colleagues. Now, let's dive into the specific benefits of vitamin K2, starting with bone health. Vitamin K2 plays a critical role in the activation of osteocalcin, a protein essential for bone metabolism. Osteocalcin is produced by osteoblasts, the cells responsible for bone formation, and requires vitamin K2-dependent carboxylation to become fully functional. A 2018 study by Akbari and Razuli Garudi explained that carboxylated osteocalcin has a high affinity for calcium ions, allowing it to bind to the hydroxyapatite crystals in the bone matrix, thereby promoting bone mineralization and strength. Numerous studies have investigated the effects of vitamin K2 supplementation on bone mineral density and fracture risk, particularly in postmenopausal women who are at a higher risk of osteoporosis. A 2015 meta-analysis by Huang and colleagues found that vitamin K2 supplementation, especially with MK4, significantly increased bone mineral density at the lumbar spine and femoral neck in postmenopausal women with osteoporosis. Furthermore, the analysis revealed a reduction in fracture risk, suggesting that vitamin K2 supplementation may be an effective strategy for managing postmenopausal osteoporosis. Another meta-analysis by Cockayne and colleagues in 2006 evaluated the effects of vitamin K supplementation on fracture risk and found that vitamin K2, particularly MK4, reduced the incidence of vertebral fractures by 60%, hip fractures by 77%, and all non-vertebral fractures by 81% in postmenopausal women with osteoporosis. These findings highlight the potential of vitamin K2 supplementation in reducing fracture risk and maintaining bone health in aging populations. Interestingly, vitamin K2 and vitamin D3 have been shown to work synergistically in promoting bone health. A 2007 study by Kanapan and colleagues investigated the effects of combined vitamin K2, MK7, and vitamin D3 supplementation on bone strength in postmenopausal women. The results showed that the combination therapy significantly improved bone strength indices, as well as bone mineral density compared to a placebo group. These findings suggest that the synergistic action of vitamin K2 and vitamin D3 may be a promising approach for maintaining bone health and reducing fracture risk in postmenopausal women. Moving on to cardiovascular health, vitamin K2 has been shown to play a crucial role in the prevention and reversal of vascular calcification through its ability to activate matrix GLA protein, or MGP, a potent inhibitor of vascular calcification. A 1997 study by Luo and colleagues first identified MGP's role in preventing vascular calcification. MGP is a vitamin K-dependent protein that requires carboxylation by vitamin K2 to become fully functional, Carboxylated MGP binds to calcium ions and prevents their deposition in the blood vessel walls, thereby inhibiting the calcification process, as explained in a 2008 study by Schergers and colleagues. Studies have demonstrated that individuals with higher levels of undercarboxylated MGP, indicative of vitamin K2 deficiency, are at an increased risk of vascular calcification and cardiovascular disease, as shown in studies by Dahlmeier in 2013 and Wei in 2016. Supplementation with vitamin K2, particularly MK7, has been shown to improve the carboxylation of MGP and reduce the progression of vascular calcification. A randomized, double-blind, placebo-controlled trial by Knappen and colleagues in 2015 found that MK7 supplementation at a dose of 180 micrograms per day for 3 years significantly decreased the progression of arterial stiffness and improved the elastic properties of the carotid artery in healthy postmenopausal women. These findings suggest that vitamin K2 supplementation may be a promising strategy for maintaining cardiovascular health and reducing the risk of cardiovascular events. Several observational studies have also investigated the association between vitamin K2 intake and the risk of coronary heart disease. A 2004 prospective cohort study by Gillespie and colleagues found that higher dietary intake of menaquinones, or vitamin K2, was associated with a reduced risk of coronary heart disease mortality in a Dutch population. The study showed that a 10 microgram per day increase in menaquinone intake was associated with a 9% lower risk of coronary heart disease mortality, suggesting a protective effect of vitamin K2 against coronary heart disease. Another prospective cohort study by Gast and colleagues in 2009 investigated the relationship between menaquinone intake and coronary heart disease risk in a population of over 16,000 Dutch women. The study found that higher intake of menaquinones, particularly MK7, MK8, and MK9, was associated with a reduced risk of coronary heart disease. Women in the highest quartile of menaquinone intake had a 20% lower risk of coronary heart disease compared to those in the lowest quartile, after adjusting for potential confounders. While these observational studies provide evidence for the potential cardioprotective effects of vitamin K2 intake, further research, including randomized controlled trials, is needed to establish a causal relationship between vitamin K2 intake and coronary heart disease risk reduction. In addition to its effects on vascular calcification and coronary heart disease risk, vitamin K2 has also been shown to have beneficial effects on arterial stiffness and coronary artery calcification, important predictors of cardiovascular disease risk. The 2015 study by Knappen and colleagues that we mentioned earlier also found that MK7 supplementation reduced the progression of coronary artery calcification, although this effect did not reach statistical significance. Another study by Vossen and colleagues in 2015 examined the association between menaquinone intake and coronary calcification in a cross-sectional analysis of 564 postmenopausal women. The study found that higher intake of menaquinones was associated with decreased coronary calcification, with a 20% lower prevalence of coronary artery calcification in the highest tertile of menaquinone intake compared to the lowest tertile. These findings suggest that vitamin K2, particularly MK7, may have a beneficial impact on arterial stiffness and coronary artery calcification, potentially contributing to the reduction of cardiovascular disease risk. However, more research is needed to fully elucidate the mechanisms underlying these effects and to establish optimal dosing strategies for cardiovascular health. Now, let's explore some of the emerging research on vitamin K2's potential benefits for brain health, insulin sensitivity, and male reproductive health. Emerging evidence suggests that vitamin K2 may play a role in brain health and the prevention of neurodegenerative diseases, such as Alzheimer's disease. A 2012 review by Ferland highlighted vitamin K2's participation in the synthesis of sphingolipids, a class of lipids essential for the proper functioning of the nervous system. Additionally, vitamin K2 has been implicated in the regulation of inflammation and oxidative stress in the brain, which are key factors in the pathogenesis of Alzheimer's disease, as discussed in a 2013 study by Pressey and colleagues. A 2008 cross-sectional study by Pressey and colleagues investigated the relationship between vitamin K status and cognitive function in a group of older adults. The study found that participants with higher serum levels of vitamin K1 and MK4 performed better on tests of verbal episodic memory and frontal lobe function, suggesting a potential neuroprotective effect of vitamin K. Furthermore, a 2015 study by Shuey and colleagues explored the association between vitamin K status and the risk of developing Alzheimer's disease in a cohort of 192 older adults. The study found that participants with higher serum levels of MK4 had a 70% lower risk of developing Alzheimer's disease over a 7-year follow-up period compared to those with lower MK4 levels. These findings highlight the potential role of vitamin K2, particularly MK4, in maintaining cognitive function and reducing the risk of Alzheimer's disease in aging populations. Moving on to insulin sensitivity and glycemic control, vitamin K2 has been suggested to play a role in glucose metabolism and insulin sensitivity, with potential implications for the management of type 2 diabetes. A randomized, placebo-controlled trial by Choi and colleagues in 2011 examined the effects of vitamin K2 supplementation, specifically 30 milligrams per day of MK4, on insulin sensitivity and glucose tolerance in healthy young men. The study found that MK4 supplementation significantly improved insulin sensitivity, as measured by the homeostasis model assessment of insulin resistance, or HOMA-IR, compared to the placebo group. Additionally, MK4 supplementation resulted in a significant decrease in postprandial glucose levels during an oral glucose tolerance test. Another study by Yoshida and colleagues in 2008 investigated the effects of vitamin K2 supplementation using 45 milligrams per day of MK4 on glycemic control in patients with type 2 diabetes. The study found that MK4 supplementation significantly reduced fasting plasma glucose and hemoglobin A1C levels compared to the placebo group over a 4-week treatment period. These findings suggest that vitamin K2 supplementation may be a potential adjunct therapy for the management of type 2 diabetes. Finally, let's discuss the potential role of vitamin K2 in male reproductive health, particularly in sperm maturation and motility. A 2019 study by Ma and colleagues investigated the effects of vitamin K2 supplementation using 90 micrograms per day of MK7 on sperm motility and sperm maturation in a group of men with reduced sperm motility, known as asthenosospermia. The study found that MK7 supplementation significantly improved sperm motility and the percentage of mature sperm compared to the placebo group over a 12-week treatment period. These findings suggest that vitamin K2 supplementation may be a potential therapeutic option for men with reduced sperm motility. While these findings on vitamin K2's potential benefits for brain health, insulin sensitivity, and male reproductive health are promising, more research is needed to fully elucidate the mechanisms underlying these effects and to determine the optimal dosing and duration of supplementation for each specific health condition. In conclusion, the growing body of evidence supports the numerous health benefits of vitamin K2, particularly in maintaining bone and cardiovascular health. Vitamin K2 plays a crucial role in the activation of osteocalcin, a protein essential for bone mineralization and strength. Supplementation with vitamin K2, especially MK4 and MK7, has been shown to improve bone mineral density and reduce fracture risk in postmenopausal women with osteoporosis. Moreover, the synergistic effects of vitamin K2 and vitamin D3 have been demonstrated to enhance bone health further. In terms of cardiovascular health, vitamin K2 has been found to inhibit vascular calcification by activating matrix GLA protein, a potent inhibitor of calcium deposition in the blood vessel walls. Higher dietary intake of vitamin K2 has been associated with a reduced risk of coronary heart disease, and supplementation with MK7 has been shown to improve arterial stiffness and slow the progression of coronary artery calcification. Additionally, emerging evidence suggests that vitamin K2 may have potential benefits in brain health, insulin sensitivity, and sperm motility, although further research is needed to establish its role in these areas. While the current evidence is promising, more research is required to establish optimal dosing and clarify the role of vitamin K2 in various health conditions. Nonetheless, ensuring adequate vitamin K2 intake through a balanced diet rich in fermented foods, animal products, and potentially through supplementation may be a promising strategy for promoting overall health and preventing chronic diseases. As with any dietary supplement, it is essential to consult with a healthcare professional to determine the most appropriate approach based on individual health needs and circumstances. And that wraps up our in-depth look at the incredible benefits of vitamin K2. If you found this video informative and helpful, be sure to visit nutritionmarket.com.au, where you can find a wide range of high-quality vitamin K2 supplements. We also have a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to learn more about how vitamin K2 can support your specific health goals. Don't forget to like this video and subscribe to our channel for more evidence-based nutrition and health information. And remember, while this video is informed by the latest scientific research, it's always best to consult with a qualified healthcare provider before making any changes to your diet or supplement regimen. Thanks for watching, and we'll see you next time.